Assalamu alaikum. Today I'm discuss about the lumbar vertebra. There are five lumbar vertebrae in number, and the lumbar 1 to lumbar 4 is typical. The lumbar 5 is atypical. So before I'm discuss about the typical and the atypical lumbar vertebra, I discuss about the general features of the lumbar vertebra. So first comes the body of the lumbar vertebra. Okay. First comes the body of the lumbar vertebra. So body of the lumbar vertebra is massive. Massive is running from its kidney shape. Okay, is kidney shaped. The anterior posterior diameter is less than the transverse diameter. You can clearly make out. The anterior posterior diameter is less than the transverse diameter. And if you see in front, it has side constriction. Okay, it has side constriction. And if you see from side to side view, it has front constriction, so it has body constriction. And lumbar vertebra is increase their size from lumbar 1 to lumbar 5. That means above to downward is size is increase. And the anteriorly, the size of the body, the length of the body is greater than the posteriorly length of the body. That's why it create a secondary curvature. Secondary curvature means the ventral convexity and dorsal concavity. Okay, dorsal concavity and ventral convexity. Okay, then the foramen of lumbar vertebra, vertebral foramen is triangular. You can clearly make out is triangular, and it is the vertebral foramen of lumbar vertebra is shorter than the cervical vertebra and greater than the thoracic vertebra. Okay, is greater than thoracic vertebra and shorter than cervical vertebra. Now I discuss about the difference between lumbar vertebra and the thoracic vertebra. In the lumbar vertebra, you can see the body is massive and reniform. Body is massive and reniform. In the thoracic vertebra, the body of the thoracic vertebra is heart shaped. Okay, is heart shaped. And the thoracic vertebra contain demifacet side the body and transverse facet for the ribs. Okay, but there is no costal facet. There is no costal facet or transverse facet in the lumbar vertebra. There is no facet. Now we discuss about the difference between lumbar vertebra and cervical vertebra. The cervical vertebra contain foramen transversum side of the body, and the lumbar vertebra has no foramen transversum side of the body. Okay, the cervical vertebra is lighter and the lumbar vertebra is bulkier than cervical vertebra. Okay, the foramen of lumbar vertebra is shorter than the cervical vertebra. So now we discuss about the pedicle of the lumbar vertebra. Pedicle is strong and directed backward. Pedicle is strong and directed backward. They attached with body slightly upward. So the inferior intervertebral notch is deeper than the superior intervertebral notch. You can clearly make out the inferior intervertebral notch is deeper than the superior intervertebral notch. Next comes lamina. You can clearly make out the lamina is short and thick. Okay, the lamina is short and thick and broad plates, and they directed posteriorly and medially. So it is called the posteromedially. they directed posteromedially and forms spine. The overlapping of lamina is minimum in case of lumbar vertebra. Over here, let me show you there is minimal possible overlapping of lumbar vertebra. So next comes spine. The spine is short, is quadrilateral plate, and is club shaped, is almost directly backward, is horizontally backward, is almost directly backward and slightly downward. Okay, is almost directly backward and slightly downward. Okay, which is thickened along the posterior border, which is thickened along the posterior border. Is apparent because is uh, thickened consequently. Okay, next comes is transverse process. The transverse process is tapering. The transverse process is tapering and directed slightly backward and laterally. Slightly backward and laterally. The transverse process is directed slightly backward and laterally, and it represents the costal element. Okay, it's homologous with the ribs in thoracic region, but the accessory process is lies the posterior inferior surface of the transverse process. It actually represents the true transverse process of thoracic region. Okay, so it is a bony elevation. And the length of the transverse process is increased from the lumbar 1 to lumbar 3, then decrease. Okay, so you can see that near the lateral end of the anterior surface of the transverse process bears a vertical ridge. Next comes to superior articular process. Superior articular process contains superior articular facet. Okay, the superior articular facet and is the inferior articular facet. Okay, the distance between the superior articular facet is more than the distance between inferior articular facet. The superior articular facet is concave. You can clearly make out is concave, and it directed backward and medially, just backward and medially. In case of inferior articular facet, its surface is convex. For corresponding lower superior articular facet and joining jaggofascial joint, which is a plain type of synovial joint. Okay, and the inferior articular facet is convex and directed forward and laterally. Okay, directed forward and laterally. Okay, directed forward and laterally, just forward and laterally. Okay, but in case of lumbar 5 vertebra, here are some exceptional. Okay, in the lumbar 5 vertebra, the transverse process of lumbar 5 vertebra is thick, short. They are pyramidal in shape, and base also encroached the side of the body, which is not in typical vertebra. Okay, the spine is small, short, least sustainable. Okay, and round in the tip. In case of lumbar 5 vertebra, the spinous process is least sustainable and round in the tip, not quadrilateral. Because of lumbosacral angle, here's a small gap between lumbar 4, lumbar 5 and sacral 1. Okay, in case of lumbar 5, the spine is very small and body is largest. In case of 5, the body is largest and height of the anterior surface is more than the posterior surface. So it forms the lumbosacral angle is what is 120 degree. In the superior articular process, the distance between superior articular facet and inferior articular facet is equal in case of lumbar 5 vertebra. Okay, if we see this diagram, is called the Fawcett's rule. If we clearly make out, if we draw some 4 lines between 4 articular facet, it will be a rectangular shape. In case of lumbar 1 vertebra and lumbar 2 vertebra, it is trapezium shape. Okay, in case of lumbar vertebra 1 and 2 is a trapezium shape. In case of lumbar 3 vertebra, it is a vertical rectangle. It is vertical rectangle, and in case of lumbar 4 vertebra is totally equal, square shaped. Okay, in case of lumbar 5 vertebra is horizontal rectangular. Is horizontal rectangle is big. Okay. Now I show you this diagram. The anterior part of the body is attached with the anterior longitudinal ligament. Okay, and just right side it attached with right cross of the diaphragm. Right cross of the diaphragm, and in case of right it will be lumbar 1, lumbar 2 and lumbar 3. The cross of the diaphragm will be lumbar 1, lumbar 2 and lumbar 3. In case of left it will be lumbar 1 and lumbar 2. Okay, and the posterior surface of the body is attached with the posterior longitudinal ligament. Okay, and side of the vertebral canal is attached with ligamentum flava. Ligamenta flava. Okay, and the fleshy sleeves of the side of the body is attached with psoas fascia. This muscle is the psoas major muscle. This muscle is called the psoas major muscle, which is covered with the psoas fascia. Okay, then comes to quadratus lumborum, which attached with the vertical ridge of the transverse process, which covered with the anterior part of the anterior layer of the thoracolumbar fascia. Thoracolumbar fascia has 3 layers: anterior layer, this is the middle layer, this is the posterior layer. So quadratus lumborum is covered with the anterior layer of the thoracolumbar fascia. Okay, and tip of the transverse process is attached with the middle layer of the thoracolumbar fascia, and inner portion of the space between spinous process and transverse process it wholly attached with the multifidus muscle. Okay, multifidus muscle, and then comes to the erector spinae muscle. Erector spinae muscle, which whole covered by the posterior layer of thoracolumbar fascia, which is whole covered by the posterior layer of thoracolumbar fascia, is attached with the middle layer of thoracolumbar fascia. The spine is attached with supraspinous ligament superiorly and infraspinous ligament inferiorly. This is the figure. This is the corresponding upper and lower vertebra of lumbar. This is the supraspinous ligament. This is the infraspinous ligament. Okay, that is how they will be attached. And in case of lumbar vertebra, here inferior surface of the transverse process and corresponding superior surface of the transverse process is attached with medial part and lateral part of the intertransverse muscle. Okay, intertransverse muscle. The medial is short and the lateral is big. Understand here? And this is the ligamentum flava, interior of the vertebral canal. And in case of lumbar 1 vertebra, the vertebra can contain the conus medullaris. Conus medullaris is a tapering end of the nerve fiber, okay? And lumbar 2 to lumbar 5 contain the cauda equina. Cauda equina is a branching of the nerve roots, okay? And myelin sheath.